On the subject of urinary incontinence, that includes urgent continence, where it's an overactive bladder, where you can have the urgent need to go, where you put the key in the door, or sometimes where you've done some dysfunctional voiding, where you're going just in case, you're straining to go, things like that. So we're causing a problem with our bladder and not letting the bladder fill completely. We also look at stress incontinence, which can be where you're leaking with laughing, coughing, sneezing, or you can have a mixture of both incontinence.